So, in most children and teenagers who have normal, healthy life, chest pain is not caused by a heart problem. Most of the time, it involves a chest wall, which is made up of structures which surround the heart and lungs, including ribs and breastbone, to be involved in the chest pain. Often, it is associated with coughing or straining of muscles around the rib cage. Occasionally, you might have viral infections that cause inflammation or infection of the joints between the ribs and the breastbone, and all of this can lead to pain. This is called costochondritis, which is a type of musculoskeletal pain, and with this forms the most common reason for why children have a chest pain. Some other causes of chest pain can be lung infections, breathing difficulties like asthma, reflux disease causing a lot of acid and heartburn, or sometimes emotional or behavioral responses like stress and anxiety. Uh, Occasionally, we might not know why the chest pain is occurring, but as I previously said, it is very unlikely a cause from the heart problem. So, for many children, as I said, the heart is a identifiable organ in the chest, and so if there is a chest discomfort, often children correlate it with the heart and feel that the heart is an issue. But in very rare cases, a heart problem can cause chest pain in children. Often, the warning signs that cause chest pain from a heart problem are very different to a very generalized type of chest pain. And if the patient or the child is not very sure, they should seek specialist attention by going to their GP or a pediatric cardiologist to identify if there's an underlying problem causing that to happen. So, if a pediatrician or a GP is unsure about the cause of chest pain, they should refer the child or the patient to a pediatric cardiologist. The pediatric cardiologist will listen to your child's heart and ask the patient and the child questions about the circumstances associated to the chest pain, the previous and medical history for the child, medical history of the family, and certain questions related to the most likely causes of chest pain related to the heart in children, like whether the chest pain is happening during physical activity, exercise, or the chest pain is related to some sort of defects that is running in the family, or some sort of a heart muscle disease like cardiomyopathy, which also runs in the family. He will then perform an ECG, which is a recording of the electrical activity of the heart, an echocardiogram, which is a detailed ultrasound scan of the heart, in order to check that the heart function and anatomy is normal. Sometimes the pediatric cardiologist might recommend further testing like certain blood test, exercise test, also longer recording of the heart rhythm like a 24-hour ECG, and more detailed imaging of the heart if it is necessary. As mentioned, most chest pain in children are musculoskeletal or arising from the rib cage and the muscles around the chest area. And painkillers are often enough to reduce or alleviate the symptoms. Occasionally, other causes of chest pain, like chest infection, then in those scenarios, the children might be requiring treatment with antibiotics. If it is related to reflux disease or acid, then they might require antacids. Or if it is related to stress and anxiety, that might have to be dealt with making behavioral changes. Rarely, chest pain is caused by a heart problem. And as I previously mentioned, if there is some concern or uncertainty of where the chest pain is coming, they should be referred to a specialist like a pediatric cardiologist. Many children say that their chest hurts at some point during the growth and development, and most of the time it is musculoskeletal in nature. Chest pain in children is very rarely due to the heart. Understandably, parents often worry that they could find a problem with the heart when the child complains of a chest pain. Parents should keep a note of the type, frequency, and the severity of the chest pain. They should check if it happens during rest or activity, if it is related to some sort of stress, anxiety, or panic attacks, or sometimes it's related type of a chest infection or acid reflux, which causes heartburn. Now, if they're unsure or are concerned, and if it is ongoing for a long period of time, they should certainly approach their GP or pediatrician to see what the reasons for the chest pain could be. Many times, they might not have the answers, or it might be difficult to identify, in which case, they should then be referred to a specialist pediatric cardiologist.